So my name is Nikita Burke and I am the Programme Manager with Evidence Synthesis Ireland. And thank you, Joanna, for introducing ESI, which I don't need to do now, but our main aim is to build capacity in evidence synthesis. And I'm delighted to be co-presenting today with Maureen and Andrew. And just as a primer, in case anybody doesn't know and is joining us from the public and patient side of things, what is an evidence synthesis? It's this jargon word that we use quite often. Well, essentially, healthcare decisions should always be informed by the best available evidence. And we all know that, there's so many studies coming out, there's an absolute overload of information. And so it's really important that we don't rely on the results from a single study. And that's because a single study could be inaccurate or it could be misleading, and it doesn't always give the full picture. So we often sometimes only hear about, surprising or dramatic findings, and we don't hear often about neutral findings. But by carefully combining the results of many studies that are looking at the same topic, we can get a better picture of the evidence. So we can get an overall view of what's actually going on and which way the evidence is actually sitted. So this method is called evidence synthesis, and it's also, you might have heard about a systematic review, which is a type of evidence synthesis. And another type of evidence synthesis is a rapid review. So we'll mention rapid reviews in this. So just to give a little primer again on rapid reviews, it's a form of evidence synthesis. And essentially it just is a type of a way of organizing the evidence and summarizing evidence of many different studies to produce evidence for people such as the public, researchers, policymakers, and funders in a rapid, resource efficient manner. So a rapid review just essentially speeds up the process of doing a conventional systematic review. So as you can imagine, these were very important during COVID times. And they're a resource efficient way of answering healthcare questions, but they're a relatively new method and we don't know that much about them. So our paper today that we've published recently is focused on public involvement in a methodology priority setting partnership that was focused on rapid reviews. And this paper was recently published in Research Involvement and Engagement. And if you scan the QR code, it'll bring you there. And essentially, it's a reflective learning paper that helps kind of share some of the methods that we found useful in our study. So what is methodological research? So I was just talking there about kind of the methodology of rapid reviews. And essentially it is research that aims to improve the quality of research. So we do research on illnesses, diseases, and ways of delivering healthcare, but we also do research on research. So the important thing about this is that we want to have an evidence base about the methods that we're using to make sure that they're the most efficient, they're the most appropriate methods to reduce the potential for research waste. And we find methodological research exciting and important because it has the potential to influence many types of studies that are done. So an example of this methodology research is a study that looks on how we can improve the recruitment and retention of patients in clinical trials. So as you can imagine, the findings from these type of studies are applicable across all clinical trials, and you can look at some of this research on priorityresearch.ie. So now I'll hand over to Andrew to introduce the team.
Hello, it's really great to be part of this and to represent with Maureen, our core team here. This particular project involved a whole host of patient partners, but the core group were the 5 of us that you can see on the screen. We all have experience of being involved in patient and public engagement activities. We come from different perspectives on this, and we come from Ireland and Canada and England. So we bring a different range of perspectives and experience. And as you can see, we were supported by this expert team of Nikita, who you've been hearing from, Linda, Declan, Claire. And well, it was a really exciting journey because I think that we're all a bit out of our comfort zone we were probably used to dealing with particular areas of health research, but to find ourselves in this kind of research about research environment was quite a challenge. Do you want to go on to the next slide, please? Fundamentally, what we're all involved in is aiming to improve the quality and relevance and appropriateness of research. And we're all committed to the notion that patients and the public can be involved at every stage, from the formation of research questions right through to the studies themselves and dissemination. I like the NIHR definition there, PPI defined as research conducted with or by members of the public, rather than to, about, or for them. The names are different in different jurisdictions. I know that Maureen, for example, in Canada, they tend to talk about engagement and so on. So we have different names for it, but the fundamental principles, I think, are the same. Nikita.
Thank you, Andrew. So there's been a debate about and it might not be immediately obvious as to why we should involve the public in methodological studies, because essentially it's researchers that do methodological studies and they're kind of the end users of methodological research. But it is very important that real world perspectives are included in methodology research, because it can ensure that we reduce research waste, that it enhances the relevance and value of research, and involvement can improve our processes and transparency and impact of research. And also, all of our research is publicly funded, or the most of it, the majority of it is. So the public have a right to be involved and research, and to ensure that research is in the public interest. So there's been a healthy debate on Twitter recently about this particular topic, and I've just chosen some snapshots here from the community, that are highlighting, lay people pay for research, so they should have a say in it, and that it is tricky. It takes planning and support, but it's very important, particularly when the end goal is improving public health and patient outcomes. And as Derek says here, is co-author in a paper, we're not trying to turn our PPI contributors, our public, into mini researchers, but there's a lot of learning that can happen, particularly around communication or understanding of, and it's really important that we share risks. But there's not a lot of understanding about how we can actually do this. So as I said, there's a lot of challenges. It's not immediately obvious. So if you're working on a condition or on a health service, it's very obvious where a member of the public or a patient might bring their lived experience, but it's less obvious in methodological research. So there's a challenge there for us researchers to communicate that. There is, as I said, this perception amongst some methodological researchers that it's not useful. We disagree, obviously, but there is also a lack of established approaches and in the literature of actually what to do and where to go. So we wanted to do a study to help add to the evidence-based, to help report what we'd found and share our learning with other researchers. So the context of this case study sits within Priority 3, and Priority 3 was a priority setting partnership. This brings together public partners, researchers, clinicians, policymakers, funders, and we did this with the James Lind Alliance. And the topic, again, usually it's top 10 unanswered questions in, say, diabetes or asthma, but this one was the top 10 unanswered questions on how we plan, do, and share the results of rapid reviews. So again, it was just that little bit more complex. And what it comprised of, Priority 3, was an initial survey, an interim survey, and a consensus workshop, and this was guided by the steering group. And you can read that paper by Claire Beecher that was published in the Journal of Clinical Epidemiology. So as the focus of Priority 3 was on the methodology of rapid reviews, there was learning that was happening in the approach to public involvement, because it was quite complex, and there was a lot of kind of back and forth, and our public partners felt it was very important to try and capture this learning in real time, so that as we were ongoing. So the Priority 3 project started in July 2020, and it was held online until June 2021. And this qualitative case study that we are presenting today was on priority 3, and that happened kind of in parallel, just slightly staggered, from September 2020 to March 2022. And myself and Linda Beastie, who helps us with Evidence Synthesis Ireland and the qualitative evidence synthesis side of things, helped me collect this data and analyse this data, and it was fed back to the group for their interpretation to ensure that what we were collating and collecting was in line with their views. So we reflected on the processes and the learning, and we did this by kind of 3 processes, so 3 methods. So one was participant observation. So I sat in on steering group meetings and the PPI group meetings, and took field notes. We analysed documents, so agendas, minutes, email discussions, and we also carried out interviews, both one-on-one and focus groups, with our public partners as well as our researchers and methodologists. And all members of Priority 3 steering group were invited to participate in this study. And why we did this, as I said, was to explore public involvement and to give practical insights into what happened during this particular priority setting partnership that would be helpful to inform other research teams who are looking to do public involvement in the methodology research space. And it's very important to note that our public partners did not want to frame this as an evaluation, because there's a perception that it's something is good or bad, or that it's particularly measurable. There was a lot of learning on this that was very much about the experiences of the people that were going through this project, and that's why we chose qualitative case study design. So their public partners felt it was really important to capture how researchers and the public are working together and reflecting on what both groups learned in a way that would be useful for both the research community and the PPI community. So just before we go into some of our results, this is the figure from our paper that will highlight some of the main themes that are along the outside there, and some of the sub-themes there: perspective, grounding, building relationships, reciprocity, space and support. And as you can see as well, at the heart of this is communication and trust. So just to keep that in mind. So we don't have time to present everything today, but we've highlighted some, and the rest are in our paper. And now I'm going to hand back to Andrew for now.
So theme 1 was this theme of bringing a whole variety of different qualities to the table. This illustration is tremendously misleading. It would have been lovely if we could have all been in the same room and sharing cake and cutouts on a table like that. And of course, during the pandemic, we were all stuck behind computer screens. That, I have to say, that didn't stop this feeling of a terrific wealth of different experiences coming to the metaphorical table. And particularly when we got to the consensus meeting, actually in some ways it played to our advantage. There were people from all over the world involved in that, with very different perspectives on things, different ethnicities, different needs within their own health services communities. And that became really exciting. And I would also say that the team itself, the core team, worked very hard to make sure that everybody was heard effectively. Next slide. A few quotations from the things that people said and learnt. I think those speak for themselves. Let me just pick up one other from our paper, if I may, if I can find it. One researcher that was interviewed afterwards said, and you'll find this on page 9 of the paper, the public partners have been official brakes onto the priority 3 process overall. They've slowed us down to the benefit of the product at the end of the day, the quality within it, and what will happen at the end. It's undoubtedly been better. And I think that really gets to the nub of it. At the end of the day, we wanted to see priority 3 producing worthwhile and better results. And if, on the one hand, the heterodox nature of the public partners slowed things down at times. It also, we hope, ensured more robust outcomes. Nikita.
Thanks, Andrew. And as well, from this slide, saying that public partners have something really essential to bring to the project from their own perspective. We also had that from the researchers. So our public partners, as described by our researchers, brought a real pragmatism and a sense of feasibility to the project that was unexpected. So I think it was expected that public partners would really influence the language and communication of priority 3, the acceptability of data collection, like such as the surveys, and they did. But there was this surprising element. So as researchers, we have a tendency to very much focus on getting the right answer, and it has to be the right answer, and to kind of bury down into the details. But our public partners in this study really saw the big picture and understood that the project had to be held to time and budget. And so they brought perspectives that really helped to move the project on, and just kind of helped with that kind of overall governance of seeing the big picture. And this was really useful. So we kind of suggest that when you are recruiting public partners to a methodology study, that really communicate. You don't need to have experience in this area. Your fresh perspective is what's needed, and to ensure that you support your public partners to speak up and to acknowledge that their role is to ask questions and to challenge and to see the big picture. And it was challenging, as I mentioned at the start. It is challenging to involve the public in a methodology process or a methodology project. The researchers in this project were unsure as how to best involve the public. This kind of was resolved by working with members of the public and kind of having an open perspective of iteratively learning as we're going along. And it was challenging to balance the needs of different members of the group. So there was 5 public partners who all had differing levels of needs around and experience and knowledge of methodology and rapid reviews and evidence synthesis. As well as policymakers that we were working with that were kind of along the same line. So everybody kind of needed different levels of support, and this just we had to be flexible, the team had to be open and had to work on this iteratively. Language as well, I think this was at the very start. One of our public partners in one of the first steering group meetings said, well, what do you mean by rapid reviews? In kind of terms of, well, us as the public don't know about it, but it actually made everybody stop and realize that even the researchers had different interpretations of what a rapid review is. So there was a significant amount of work with public partners, researchers, clinicians, everybody working together to come to an agreement of a definition of rapid reviews, evidence synthesis, and others that they were happy with. And there was no perfect decision. There was no perfect definition, but everybody, the important thing, as our public partner said, was that everybody was involved in developing this. And what was really important about this process, so even though it slowed down the pace, as Andrew said, it put the brakes on things, but it really meant that there was a development of a shared understanding early on, and kind of a shared ownership of the project. And that then when the project moved on further in the future, that things actually sped up because everybody understood what everybody meant, and this really helped. And again, it was just a challenging context. Like one example was that the research team paired public partners and methodologists to review the questions that came in from the survey. And this was a really long list of questions that came from the community. And this was broken down into pairs. So they would each review them individually and then come together and then discuss their findings and send it back to the research team for review. And one of our very experienced public partners, even one of his quotes said is like, even with my experience and knowledge, I've overstepped the mark, because it was really overwhelming. But he felt that just taking time to reflect and then, having the nerves of going and speaking to the methodologist, not feeling confident in, this area that he doesn't know anything about, was really challenging. but that then when they kind of sat down and spoke with the methodologists, that they each learned from each other. So the methodologist learned how to communicate something clearly, and then the public partner learned something about methodology, and then they shared that decision making and came back to the research team with their discussions. So now over to Maureen to introduce us to theme 2.
Hello, everyone. Thank you for joining us. So over to theme 2, which is about purposeful supports and space at the table. And there's your different place settings. I won't have you guess which one was me, but I'm in there. So the people came to the study with different backgrounds, very different backgrounds. Some of them have been involved as patient or public partners with researchers and, recruitment and retention in clinical trials. Some of us had knowledge of evidence synthesis, others had none. There was also in our project, some of the public partners have been involved with priority 2, I guess. This is priority 3. Priority 2, I can tell you that was reassuring to me, because I thought, well, if they're coming back for priority 3, it must have been a pretty good team to work with. So knowing that some people had worked with the team before and were, obviously very happy with the work they had done was also encouraging for people like me who were new to working with that team. So we needed different supports and at different times, and this needed to be developed, as we were going along. No matter how much research and how much preparation you do anticipating the needs, you never really know until you're in the project what people will actually need. And I think the team was really good at adapting to that. Next slide. So one of the supports that we really valued was the peer support. And it was important that there were like 5 of us, so more than 1 or 2, and that there should be diverse perspectives and that we would feel supported by the team and group. So that was really important. We had our own meetings before where we kind of worked as a team and got to know each other. And we had this breadth of experience and of different perspectives. And that was really shared very openly. And it was a very, very welcoming environment. So the peer support in a project that's not based on lived experience is really important, because you don't have that common tie, or that common bond that you often have if you're all, living with the same medical condition. You've already got a bond when you start. Here you don't have that. Your common bond is that you're involved in research and that you want to make it better, but it's not the same as all living with the same condition. Next slide. So this peer support enabled us to, build capacity. And here it shows a little bit about the fact that it is important when it's not related to your lived experience. So for many of us, it was really outside of our comfort zone. And that's where the peer support is really important. And other people saying, you know what, it's out of my comfort zone too, but I'm here to work with you, and we're going to do this together. And I thought that was really important, and the peer support really helped with that. Next slide. Back over to you, Nikita.
Thank you, Maureen. So this purposeful support was one that the research team developed, which is a comprehensive reimbursement policy that included tasks kind of broken down and individually timed and costed. And this was shared with public partners for their feedback at the start of the project. And this is really what kind of was the catalyst for this qualitative case study. So I just have, our public partner said they hadn't seen kind of something like this before with this much detail, and they felt that it would help other researchers to kind of more accurately cost the time. So the longer version of this is in the paper in the appendix, but it's just here to kind of show you the detail that Claire went into to develop this down. And our public partner said that it helped them to feel valued, that someone had taken the time to think of their needs and to be asked on their feedback on the draft payment process. Now over to Andrew.
Thank you for that, Nikita. And I'm sure that very few of us as patient partners in research are ever in it for the money. That's entirely incidental, but it was, I think, a token of the team's forethought that they should actually give some give some thinking to just reimbursing any costs that we had and doing it before they were asked, which made a big difference, I think. The other thing that was really helpful was that in our very preliminary discussions, it became clear that we would welcome pre-meetings of the patient partners, just to get our heads around the issues each time, both the whole business of rapid reviews, but also the agenda for each meeting. And the team was very open to supporting that. Hopefully it helped the team as well, but it certainly helped us. We had 1 hour meetings in advance of each of the larger steering group meetings. And I think this did have a huge impact on helping us to engage with discussions, as well as Maureen said earlier, helping us to know each other better and understand where each of us was coming from, so to speak, because we hadn't met, by and large, we hadn't met in other contexts before. Next one, please. So it's not just about that sort of getting to know each other, it's about the space. It's about the space in terms of being around the same table, but the metaphorical space in terms of everybody's openness, the flexibility of the core team, the room for everybody's opinions, the willingness of people, particularly, you know, the old lags who are professionals at this, being willing to change or think again about what they were saying. I'm being deliberately rude and provocative there, but actually what the team did was create a really great atmosphere. And I'm sure I have something more to say about that. I think, you know, for all the systems, well worked out systems and approaches in the world, having the right kind of attitude of mind amongst both the public partners and the professionals was really important to this. That's something you probably only gain by trying it out and having the experience of working in this kind of way. Next, please, Nikita. Oh, I think that's Maureen.
Thanks, Andrew. So then the third theme is we all benefit from working together, and so true. So it highlights the gifts we receive and shared with one another, and both researchers and the public partners all spoke of the benefits from working together, that we learn from each other and we develop relationships and trust with each other. Next slide. So we found that not only the project benefit, but this theme showed us that participants emphasize the personal benefits in terms of relationships and mutual learning. Some of us have gone on to, you know, work with each other since then, or collaborate on each other's projects. And everybody spoke of a feeling of togetherness, of being partners in research, which highlights the need to invest in relationship building, particularly in that methodology space. Back over to you, Nikita.
Thanks, Maureen. So I think, you know, some of the questions that people will have was kind of, you know, well, so what difference did it make? And as I said, we didn't go out of our way to specifically measure impact or use an impact evaluation tool for the reasons I mentioned, but there were some really important areas of influence that our public partners had on this study. For example, there was immeasurably better communication, so that there was a shared understanding of, you know, the concepts and definitions. And not only did that help the team that were there and the public partners on the steering group, it really helped the design of the surveys going forward. And an example of that is that the 17% of all survey responses, there was over 200 responses per survey, and 17% of those were from the public and patients. And just to remind you, this is a rapid review methodology priority setting partnership, so it is quite complicated and complex. So the fact that there was, you know, nearly 20%, nearly a fifth of those was from the public and patients really stands to kind of the communication, the improved clarity of communication that our public partners kind of ensured in priority 3. They also really advocated for underserved groups. So this included ensuring there was representation of the survey questions in the interim survey. So there was one survey question was about, you know, including in underserved groups in rapid review methodologies, and how do we do that? And that was at risk of falling off of the list for the consensus workshops. And very, very strongly our public partners advocated for that and said, you know, it's incredibly important that we don't lose that. And so that was then actually ended up being included in the top 10. As well as the user networks to recruit public and patient participants from North America as well as Africa for the final workshops to ensure that, you know, that influence and representation. And our public partners were really involved in some critical decision making around the direction of the project. So it was that, again, that shared understanding helped them to ensure that the project moved in a different direction than it would have otherwise. I think that there is more. There's a table, again, long table in the paper and the appendices that you can look at, but they're kind of, you know, very typical about the different areas of a priority setting partnership that the public would be involved in. These are ones kind of more specific. The slides or the stills that I showed you at the start of this explaining evidence synthesis actually comes from one of the videos that the public partners requested and co-designed for priority 3 that explains the project to a public audience, and they influenced the language, the design, the diversity of characters in the video. And this was all, the purpose of this was to provide an accessible, engaging format to disseminate the survey to a wide audience. And again, to speak of influence, I think, you know, the number one question in the priority 3 PSP was, what are the best approaches to identify end users, such as including the patients and public, to have a meaningful involvement in rapid reviews. So I think that really shows the strong influence of our public partners in the study. So again, just to highlight our findings. So our findings actually, you know, they really align with co-production principles. So essentially, you know, sharing power, including and valuing all perspectives, collaboration, respect, open discussion, reciprocity, you know, communication and trust. You know, they're not groundbreaking new things. We've heard them all before, but they are really important ways of working. And I think it's really important, as Maureen said, in a methodology space. So it's not a safe space. People they're not bringing their lived experience. And it's also, I think, really challenges that assumptions that public involvement has no place in methodological research, that it's too technical or it's too different from experiential forms of knowledge for a non-technical audience to understand or meaningfully contribute to. So I think we can say from our experience and using the approaches we did, we can definitely say that there was meaningful influence on the project and meaningful impact on the public involved, and as well as the researchers. So everybody learned, everybody gained from it. So again, in our paper, we just highlight that there's some considerations that future research teams can take. Again, is when you're recruiting people, say you don't, you know, upfront, say we're not looking for your experience, we're looking for your perspective. And your role is to ask questions and see the big picture, because I think a couple of the public partners spoke to having to nearly be convinced to join, because, you know, they weren't sure, they were outside the comfort zones. We're like, what is this rapid review methodology, PSP, you know, all this jargon. And I think it was really important to create space for two-way conversation. That's essentially what it is, you know, create space to allow learning and to allow conversations, and give that time at the start to allow for a shared understanding to develop. As Maureen said as well, the peer support was really important. You know, usually we have, or more often than not, you might have 1 or 2 public partners on a project. And in this case, having 5 really kind of helped that, you know, build confidence and skills with each other, and have nearly like an identity of getting to know each other. And having 5 people really helped embolden them to contribute and challenge and learn. We'd really recommend that research teams take time to consider reimbursement policy that is comprehensive, and it's really kind of thought about all the different steps that would be involved, and to pay public partners for their time on projects. And for researchers to consider to be open and willing to step outside your comfort zones and invest in relationship building. So just to conclude, we've shared our learning from one particular context, and we've offered some practical insights that might be helpful for future research teams. It might be helpful for other non-clinical research, and we hope that these kind of strategies that we used are helpful to other research teams in the future. So I'm going to just hand over for any final thoughts from Andrew first.
No, I think we've been pretty comprehensive in the paper, and I hope that the paper is a really great support for others. I would just like to express my appreciation of the James Lind Alliance priority setting partnership approach. I think the methodology there is something that's really worth treasuring and holding on to from my patient and sort of community perspective. If all this sounds all a little bit cozy, it was often really quite difficult. It certainly stretched my brain cells, but I would also want to pay tribute to the University of Galway team, who were just great to work with. And one of the outcomes of this, and it's not really in the paper, but you know, we've just made lots of really good friends within the clinical and research environment, and amongst PPI representatives of one kind or another. So it has been a joy and a challenge to be part of. Thank you, Nikita.
Thank you, Andrew, and vice versa entirely. Maureen?
Pretty hard to follow that, Andrew, but just on a personal note, what the project did for me in many respects is give me the confidence to go out and engage in other methodological projects, because I was one of the people who really hesitated to join the team. And I know that there are several of us from this team who have gone on to reporting guidelines. For example, Derek's leading a project in surrogate outcomes. I'm doing one for Prisma Cosmin, bringing in patient and public involvement. And a lot of that confidence to go out and do it for other projects comes from working on this project. And I would say to anyone who's doing, you know, PPI and methodological research, please try to capture all of your lessons learned and write it up and share it, because it's a new area and people are looking for case studies and looking for examples of what works and what doesn't work. We just did that with the Prisma Cosmin reporting guideline, and we'll be presenting it. And it was our group of 5, recognize the number, who said, we need to share this. We need to write this up, and we need to get the word out that here are some of the strategies that work in reporting guideline, which is very, you know, same kind of idea. It's not intuitive. So I really encourage people that if you're coming into this area, and just keep track of what you're doing, try to think as you're planning your project of how you could potentially evaluate it and share the lessons learned. It's not, as we called it, it wasn't an evaluation, it was more of a reflection. So if you can reflect on it and share that, there are a lot of people who are in this field and there's not a lot of guidance. And I hope that we've contributed to that. And same for me, I just think it was a wonderful team to work with. And Andrew's right, there were bumps in the road and it was really hard work, but that working together to reach the final outcome and to reach a good outcome is what kept us all together. So thank you. Thanks, Nikita.
Thanks, Maureen, and thank you to all the team that you see here. The only person missing is Linda Beastie. But yeah, thank you all for participating. So we're open to questions now, and we're really hoping for a good discussion. So I'm just going to stop sharing.